Hi, everyone. Good morning or good evening or good afternoon, wherever you are. Welcome. We're going to go ahead and get started so that we can get through everything that we have today. I will go ahead and share my screen as we get things kicked off here. So good morning, all. My name is Kari Williams. I am the User Support and Outreach Manager at IPUMS. I'm really excited to be here today, along with some of my colleagues. I'll give them introductions in just a moment here to present the webinar. Welcome to IPUMS, an overview of IPUMS microdata resources. Before we start on the content of the webinar, I want to just go through a few webinar logistics with you all. So the webinar is being recorded and it will be posted to our webinars and tutorials page. Someone will pop a link in the chat to that page in a moment. You'll also get a link, that link in an email following the webinar. Real-time closed captions are being auto-generated. So if you're seeing those and you don't want to be, or you would like closed captions on, you can click on the CC or the closed caption button in Zoom controls. Depending on how small your Zoom window is, you may need to click on the ... more option. If you have any questions about the technical piece of the webinar, you can send questions directly to IPUMS, the host. So you can send those as a private message, and my colleague Amy Gratzen, who is our outreach coordinator, will try and help you troubleshoot those. If you have any content questions about IPUMS, about microdata, please submit those using the Q&A tool, not the chat. It's just easier for us to track those questions as they're coming in when you submit them that way. And then we will post a written Q&A document following the webinar. So if you ask a question and we aren't able to answer it before the end of the webinar, we'll keep an eye out. Again, we'll share a link for the recording and that written Q&A document where we'll provide answers there. So with that, I want to stop, but before starting, I want to do a quick thank you to, I mentioned my colleague Amy Gratzen, the IPUMS Outreach Coordinator, who's running technical aspects of this webinar, but I also really want to thank Grace Cooper and Ivan Strahov, who work with me on the IPUMS user support team. You may have received emails or forum responses from them about your questions. They'll be helping field questions today. So I want to thank all of those folks for being here and all of you for joining us. With that, I will go ahead and get started. So today, a quick overview of what we'll be doing. I'll do a high-level overview of what IPUMS is, thinking through IPUMS, assuming that you're relatively new to that. I'll talk about the microdata that are available through IPUMS, and then the benefits of IPUMS, why people use IPUMS versions of these data. And then I'll do a brief demonstration of the IPUMS USA website. If you have questions at any point, again, pop those in the Q&A tool. Also, following the webinar, you can always email IPUMS, IPUMS @umn.edu with questions that you have about the data. So if things occur to you after we're done with the webinar, that's a great way. Grace, Yvonne, and I, and another colleague, Matt, of ours, monitor that email address. With that, I'll go ahead and get started with an introduction to IPUMS. So what is IPUMS? IPUMS provides US and international census and survey data. So these are data that are being collected by national statistical offices or other government organizations, or sometimes foundations. So we're taking those data that are already available, and then we get funding through the National Institutes of Health and the National Science Foundation, among others, to improve data accessibility. That's why IPUMS exists at its core. And then we integrate documentation and have standardized data. And the goal is to streamline your analysis. So you have a research question, and our goal is to get you from research question to analyzing much faster and save you some of that data infrastructure work. And then we offer all of this free of charge. And this is where the NIH and the NSF funding make a really big difference. So that's how we're able to provide these data free of charge. The IPUMS model at a high level, how you might think about using IPUMS, is that we provide data and documentation through our web-based dissemination system. So you go onto the IPUMS website and you create a customized data extract that has just the variables and samples of interest to you. You download and analyze those microdata. You get user support through tutorials, the user forum, our dedicated user support team. And then you publish your really amazing research and you cite IPUMS. Those citations are part of what help us keep getting funding so we can keep offering this for free. But that's sort of the high level approach. So that's how IPUMS works and what we do. Next, what I'll do is move on and talk about the IPUMS microdata collection. So what are the actual data that we have available? Before I go further into this, I want to do a quick overview of what I mean when I say microdata, because I want us to all be on the same page with this. So microdata are specifically in contrast to tabular or summary data, right? So you might think about a different form of data being a table that shows you the age and sex breakdown of counties in the US. That's tabular data. It summarizes the information. Microdata look a little bit like this. So this is a single person in a microdata file. So this is one individual and all of their responses to the assorted questions or their variable codes, right? So here's one person, and you can see here are 3 other people. So this is a household, and the columns here correspond to different variables. So you can see the relationship to the head of household, the marital status, their education, and their occupation. In this case, we're looking at a family, so married parents and their 2 children here. So that's what the underlying file looks like. And you can use these data to create your own custom tables, right? Maybe the pre-existing summary statistic doesn't exist. So you can use these data to generate that, or for other analyses that are more complex and require those individual level data. So what I'm talking about today are microdata that are available through IPUMS. If you were to go to IPUMS.org, you would see this. So this is a quick summary of the data collections that are available through IPUMS. I won't be talking about IPUMS NHGIS or IPUMS IHGIS today, because those are tabular and spatial data resources that we have available. We have some resources for folks who are interested in those data collections. Follow up with us afterwards by emailing ipums@umn.edu for access to some of those. With that, what I'd like to do next is do a quick overview of each of these microdata collections to just give you a sense of what they include. I think that can be helpful as you're trying to choose data for your research or understand what's available. So I'll start with IPUMS USA. IPUMS USA offers the US decennial census data going back to 1850. When 2020 data are available, we will certainly include those as well. But right now we have 1850 through 2010. And then we also have the American Community Survey data for 2000 through 2020. For those of you who are familiar with census data, the American Community Survey basically replaces the long form census. So a subsample of folks in earlier censuses would receive a longer questionnaire known as the long form that had more detailed questions that gave you a wider array of variables. Now the American Community Survey has replaced that long form and is collected annually. So these are more detailed questions that replace that aspect of the decennial census. IPUMS USA also offers full count historical census data for 1850 through 1940. 1890 census microdata were lost in a fire. No one has them, so it's not just that IPUMS is withholding them from you. They don't exist. We'll be adding the 1950 data soon. So after 72 years, census records are released, and so it is 2022. So the 1950 full count files are on our radar for starting to work with when they become available in April of this year. IPUMS MLP is a special project that's part of IPUMS USA that links individuals across these historical full count censuses. So you can observe the same individual across decennial census in those historical files. So that's IPUMS USA. Next, I'll talk briefly about IPUMS CPS. So this IPUMS CPS includes the current population survey data. These are labor force. This is a labor force survey with topical supplements. We offer the basic monthly surveys for 1976 through the present, and then the annual social and economic supplement, or the ASEC data, for 1962 to the present. So a lot of this is about labor force, but I want to pause and note that the topical supplements included in IPUMS CPS are not just about work. So tobacco use, fertility, education, voting, and registration are examples of some supplements. I also want to note that the CPS is actually a short panel. So you can observe the same individuals up to 8 times over a 16-month period. So there's that, a brief summary of CPS. I'm guessing that my face is blocking some of these slides, so I'm going to go ahead and stop my video so that you all can see more of the slides and less of my tiny head talking. All right, so next I will talk about IPUMS International. Let me get clicked in here. So IPUMS International is census and labor force survey from around the world, primarily census data, though there are some labor force surveys too. Over 100 countries are included here, and it includes both modern and historical data. So that's kind of a high level summary with over 100 countries. It's hard to provide a lot of detail, but one really cool thing about IPUMS International is that it provides geographic identifiers for a consistent spatial footprint. So as boundaries change over time, you can look at the same actual place. And then there are also geographic identifiers designed to facilitate comparability with the demographic and health surveys data. And I think if you aren't familiar with DHS data, we'll talk about that in a moment. But the idea here is that you might want to use these census microdata from IPUMS International to create some contextual variables to use with other data sets from the same countries. And we have some really cool geographic resources to facilitate that. Next, I'll talk about IPUMS Global Health. IPUMS Global Health currently includes 2 data sets. So first, the IPUMS DHS, which is the demographic and health surveys. So these are maternal and child health data for low and middle income countries, including topics like family planning, decision-making, HIV and AIDS, domestic violence, sexually transmitted infections, malaria, health behaviors, healthcare access, utilization, vaccination. There's a lot. There's a lot in DHS. There are 41 countries currently included in DHS that will be expanded soon. And IPUMS DHS is a partnership with the DHS program and ICF International. The second data collection included in IPUMS Global Health is IPUMS PMA. So this is the performance monitoring for action data. This provides family planning data for 11 countries. And recently, PMA, the original data collection, switched to providing panel data for family planning. So you can observe those same folks over time, which is really cool. It had previously been a repeated cross-section, but it's now a longitudinal data resource. You can expect those first longitudinal files to be available through IPUMS later this year. The PMA Data Analysis Hub is another cool resource that I'd like to highlight. It offers research ideas, sample code, and details on recent data releases. And the data collection for IPUMS PMA is funded by the Gates Foundation. I also want to briefly mention, coming later this year to IPUMS Global Health will be IPUMS Mix. So this is the Multiple Indicator Cluster Survey. This is a UNICEF survey of child health and well-being. So that's on the radar. Keep your eyes out for that in the coming months. Next, I'll go ahead and talk about IPUMS time use. IPUMS time use includes 3 different data series. So I'll stop at the outset here and talk about time diary data in general. So time diary data are basically where folks report what they were doing over a set period of time. For example, in the American Time Use Survey, this first data resource available through IPUMS Time Use, folks report what they were doing over a 24-hour period. So from 4 a.m. yesterday to 4 a.m. today, what were you doing? And it can also include really cool information. ATUS has things like who you were with when you were doing certain activities, and that's a great resource. And ATUS specifically has a well-being module. So they ask about some quality of life questions during randomly selected activities. So things like how happy you felt during certain activities. This well-being module has been fielded in the past, and the 2021 ATUS data will include a well-being module that's being funded by the National Institute for Child Health and Human Development and the National Science Foundation. And this supplement and these data will be comparable with previous ATUS well-being module data. So that's a really cool thing. So the ATUS time diary data, this is a consistent series for 2003 through 2020. Collection is ongoing. There's also the American Heritage Time Use series included in IPUMS Time Use. And so these are harmonized time diary data sources that aren't all from the same original source. The ATUS is a singular survey, there's more consistency there. The AHTUS takes other time diary data collections and works to create a comparable series that goes further back in time. So these data are for the US and they go back to 1965. And then the multinational time use series, or MTUS, is that same idea, but it takes time diary data from 12 different countries currently, and those data go back to 1965 to facilitate some cross-national comparisons. That's IPUMS time use. Next, I'll talk about IPUMS health surveys. IPUMS health surveys includes two different data sets. First, the NHIS, or the National Health Interview Survey. These are annual survey data that are available going back to 1963. And they provide broad topical coverage of sort of health-related things alongside really detailed demographics. So you can think about health conditions, health behaviors, disability, healthcare access and utilization, health insurance. This is a premier source of health and healthcare usage in the US population. And those detailed demographics make it easy for folks that are interested in really unique subpopulations. So that's a bit about the coverage there. A really cool feature of IPUMS NHIS is that these data are linked to mortality data from the National Death Index. So people who were in the NHIS in 1986 through 2014 are linked with deaths in the NDI through December 31st of 2015. So you think about all of these detailed health items and observing then when folks die, it can facilitate some really interesting research. The second data collection available in IPUMS health surveys is the Medical Expenditure Panel Survey. So this is a panel data set. A new longitudinal panel begins each year. First year of data collection was 1996. And people are interviewed 5 times over about 2.5 years. One cool thing to note about this panel is that it follows people rather than households explicitly. So if you think about some cool demographic transitions, right, marriage, divorce, death of a spouse, birth of a child, these are things that might cause people to move. And if you only followed households, the physical structures instead of the people, you would miss following up on some of those demographic transitions. But because MEPS follows people, it facilitates some of that, kind of a cool feature of these data. They provide detailed information about medical expenditures alongside health topics and demographics. And the sampling frame for IPUMS MEPS is actually the National Health Interview Survey, so it can be linked to the NHIS. Those links are restricted, so you need to access a federal statistical research data center to get those links. But I think something that I want to mention, it's a 6th observation and adds an additional year to that panel. The last data set that I'll mention here is IPUMS Higher Ed. So IPUMS Higher Ed is from the Scientists and Engineers Statistical Database, or the CSTAT database. These data are available for 1993 through 2013 and are comprised of 3 different surveys: the National Survey of College Graduates, the Survey of Doctorate Recipients, and the National Survey of Recent College Graduates. And really the focus of all of these are folks who have received science and engineering degrees and people working in STEM occupations. That's a summary of the microdata collections. And I think in general, people choose their data, the data that they're working with, based on that topical coverage. You probably have enough information to start thinking about which of these data sets is of most interest to you. But I want to highlight a few other considerations that might be important. So the first is geographic detail, right? That varies. One trade-off of microdata when you see one person and all of their responses is to protect anonymity, right, of those people, of the respondents. You sometimes obscure detail in other areas. So if you wanted state or sub-state identifiers for US data, you'd need to be using IPUMS USA, IPUMS CPS, or IPUMS ATUS. With IPUMS International, the most detailed geography typically available is the 2nd administrative level. So you can think about this as basically typically one level more detailed than state or province. So county, prefecture, municipality, or district might be examples of this. So if you need greater detail, then that's an important consideration. Another thing is your target population. So the census data typically looks at all persons, right? So for IPUMS USA and IPUMS International, you're going to get all persons, not a big deal. IPUMS CPS, HUS, and the IPUMS health surveys, they focus on the civilian non-institutionalized population. So basically, people who are excluded here are folks in the armed forces, people in nursing homes, folks in prisons, right? Those groups won't show up in these data. And then the focal population for IPUMS DHS and IPUMS PMA, the focal population is women of childbearing age. So you can get information in some samples on other members of the household, but that's really who the target population is. So those are a few considerations. With that, before I talk about why you might use IPUMS, I will pause here. I'll turn my video back on and check in with Grace and Yvonne to see if there are any questions that we should answer before moving on.
Yeah, I guess we've kept up pretty well with them. There is one question. Does IPUMS have resources on computational methods to allocate PUMS microdata points to a finer spatial level, such as PUMA level to the census tract? And if not, are there any institutions that they can reach out to?
That is a great question. We have some resources, but I want to make sure what I'm going to do is direct that question to ipums@umn.edu. So I'm not providing an answer off the cuff that might be inaccurate. But IPUMS does work with geographers to infer lower levels of geography from available resources. So within IPUMS USA, the PUMA is the lowest level of geography. These are sort of not arbitrary, but not super meaningful geographic areas that contain at least 100,000 people. Using PUMA delineations, our geographers infer things like city or county where possible. So for about half of the persons in the PUMS data, we can identify a county. I don't know what the percentage is for city or metropolitan area. So there's some resources on that. Going down to tract, I think if you could infer those, that would represent a confidentiality concern. And I suspect that that's very difficult to do, but as a non-geographer, I can't comment on that definitively. Any other questions that we should answer now?
I guess there's just one other. Given the advantages of harmonization beyond MIX and DHS, will you bring the other surveys, MIS, AIS, et cetera?
We really like adding more data. So to the extent that we're able to find funding to expand access, it's certainly something we consider. We're often looking for what are really high value data resources that people can use, that we think they'll do great research with, but have high startup costs, right? If it's really easy to use a non-harmonized version, then we want to invest our efforts where we're really streamlining that research pipeline. But if folks have suggestions, we're certainly open to hearing those.
All right.
Thank you. With that, I'll mute my video again here, and we'll go back to why folks might use IPUMS. So there are 6 reasons that I think you might use IPUMS. I'm going to spend the most time talking about harmonization, this first reason, because I think this is sort of the hallmark of IPUMS. So when I say harmonization, what I mean is offering a single consistent data series from data sets that were collected in different times or different places. And you can think about the way that you provide that consistent data series is by coding things in a way that groups broadly comparable categories together while retaining sample-specific detail and then flagging potential comparability issues. What I'm going to do next is a really simple example of this to try and help illustrate what harmonization looks like. So the National Health Interview Survey has a small change in how they report legal marital status. Prior to 2004, folks could be not in universe, so these are essentially people who are too young to report marital status. For people who are married, you don't just say married, they report whether or not the spouse is present in the household. That's available before 2004, and then widowed, divorced, separated, or never married. So these are what the categories look like before 2004. Starting in 2004, that detail in whether or not the spouse is present is lost. from the married variable. It's not included anymore. So that's one thing to note. The other thing is the numeric codes have changed, right? So separated was a code of 6 prior to 2004. Beginning in 2004, it's a 1 in the original data. If you were going to bridge this gap and you wanted to look at a time series, right, pre and post 2004 for any reason, you would need to accommodate these. And this is where IPUMS harmonization comes in. So here on the right-hand side, you can see these are the harmonized codes. So these are the kinds of codes that we would apply in this situation, where the first digit of the code is consistent across all years. So you can see here, a 1 in the first column always means married. And we use this second digit to convey detail that's specific to certain samples, in this case, the pre-2004 data. So you really, if you don't need that level of detail, you can ignore that second column, and some of our data collections have features that allow you to get that general version of the variable that doesn't include the detail. This is what this might look like under the hood, right? So we've created this crosswalk that says, all right, a code of 4 prior to 2004, a code of 5 in 2004 forward, those are all widowed, and we're going to assign them this code of 20. This is work we're doing behind the scenes. All you see are these harmonized codes. So that's a simple example of what harmonization might look like, but you can imagine how that's useful for more complex for more complex variables with even more variation over time. So harmonization is the big one. The second thing I'll talk about, though, is custom data extracts. So you might want to pool together multiple samples. Let's say you want 10 years of annual data. Well, you'll need to at least append those 10 files together, and it might be more depending on the data source, right? Some data collections have multiple files per year. So if you were going to pool all those samples together, first you'd want to check the variable names over to make sure that those hadn't changed over time. Then looking at the codes, right? That's the harmonization piece that we just talked about. And then simply the mechanics of stitching the files together. If there were multiple files in a given year, making sure that you have the right identifiers so that you're merging those files correctly is a lot of work. If you were sometimes you might want every single variable in a file. Oftentimes you don't. If you're looking at 10 years of data, you might be starting to think about space concerns. So getting rid of some extra variables that you don't want. IPUMS allows you to choose just the variables that you're interested in. You can also select your preferred data format. So you can get, by default, the data will come as a fixed width file, and you can get a syntax file for reading them into Stata, SAS, or SPSS. We have tools for reading these into R as well, but you could also get data that's formatted. So you can just open the file in the native format for Stata, SAS, SPSS, or a CSV formatted file. Finally, your data request history. So here I'm going to show you, this is the top section of my data request history for IPUMS NHIS, but you can see there's this description field. I know what I've requested in the past, so I can go ahead and modify that. I don't have to remember. I can use previous extracts as a template, which is a really great resource. The third reason is documentation. So there's a big emphasis on comparability at IPUMS, right? We want to make sure folks know what's happened, and variables change over time. So again, thinking about this 10-year example, you would typically need to open 10 different annual description documents. Search for your key variables to understand them. IPUMS associates variable-specific documentation with the variable on our website. I'll show you an example now, and when we do the website demo, you'll see that again. So again, that's that piece where there's documentation associated directly with the variables. We also provide supplemental documentation with additional detail on key topics. So you might think about topics that cut across variables, studying the Affordable Care Act, changes to a sample or survey design, notes about occasional topical supplements, things like that are all available. And then you get a summary codebook with every custom data extract. So that way you have a description of that data that you requested from IPUMS at the time. This is the IPUMS USA race variable. This is just the first paragraph of the comparability section, but race is an example of a variable that has changed a lot in the way it's measured over time. And so this documentation is here. And so going back 1850 through 2020, you can understand key changes to how race is measured. with one click, instead of needing to look at all of those separate years of documentation. The fourth reason is the online analysis tool. So we use UC Berkeley's survey documentation and analysis tool. I'll share a link to a brief video tutorial and a page where you can find sample exercises for navigating the tool in an email following the webinar. We won't have time to go into this today, but it's a web-based tool for analyzing harmonized IPUMS data. You don't have to create a data extract or have access to statistical analysis software to use this. And you can actually export your results to a CSV. So as a quick example, it took me about less than a minute to make this figure that shows women's labor force participation over time. It was easy to do with the SDA tool. This is really handy for a lot of different reasons. Reason 5, data enhancements. So these are some special things that IPUMS does to try and make the data even more powerful and even easier to use. For example, family interrelationship variables. People often report how they're related to a single reference person in a household. If you're a household that has 2 parents and their 2 children, these aren't very useful. That's easy for you as a data user to infer. But let's say you have a more complex household. So you have a household reference person living with their adult children and their grandchildren. It's harder to identify who's married to whom, who the logical parents of folks are. We use an algorithm to make assignments of a person's probable spouse and parents based on insights across data sets, and we apply the same logic across the IPUMS data collection, so they're consistent. We have harmonized occupation and industry coding schemes. So occupation and industry codes are periodically updated to reflect the changing labor market. These are really important for accuracy, but they make it harder to compare things across time. So again, these use a consistent methodology to look at changes over time and sort of identify how certain occupations or industries are collapsed or divided so that folks can use something that works for the full time series. There are derived geographic identifiers. I talked about this a bit with IPUMS International, and someone asked a question that allowed me to talk about it for IPUMS USA, but changing boundaries or geographic detail over time can make it hard to know if you're comparing the same place. We have geographers that create variables to compare the same facial footprint or derive lower levels of geography where possible, and create meaningful units for any summary statistics that you might append to other data. And finally, linking resources. We talked a bit about linking historical decennial censuses over time, CPS linking resources, linking NHIS to the National Death Index. So there are some cool linking resources that are available too. This is the IPUMS CPS page that's dedicated to leveraging the CPS as a panel. So there are a lot of resources on that. This is the IPUMS MLP information page. So here you can see the number of individuals that are linked across censuses. The last reason that you might use IPUMS is user support. We don't do analysis on behalf of data users or answer analytical questions like what kind of model you should use, but we do answer questions about the data. So we have video tutorials, sample exercises, data user forum, and email support, ipums@umn.edu. I should have mentioned this at the start. If you don't want to listen to any more of the presentation, just take away ipums@umn.edu is that, I would say that's where to start with questions. So what I'll do next, I'll move to a website demonstration. I want to pause and see if there are any questions that we should answer before moving on to the website demo.
Actually, no, there's no outstanding questions.
Wonderful. I've perhaps talked all of them into submission. Please keep the questions coming. I promise if we don't get a chance to answer them in person right now, we'll get those in that written Q&A document. All right. So with that, I'll do a quick demonstration and I'll do the IPUMS USA website. So if you are welcome to follow along now or later, if you head to usa.ipums.org, that will give you, that's where we'll start. So here I'm at IPUMS USA. I want to do a quick landing page orientation for you. So by default, I'm hoping you all can see my mouse, you're going to want to click on get data, or I assume you're going to want to click on get data. That makes sense. There are a lot of other resources here though, and I want to take a moment to painstakingly walk you through those to direct your attention to them. So here on the left, you'll notice browse and select data. Analyze data online is where you get to that handy online analysis tool. Again, I'll send resources out about that later. The supplemental data, geography and GIS. So for IPUMS USA, this has a summary of some of that information that we've talked about. The linked census data is where you would find the IPUMS MLP, so linking those individuals in the public use versions of the historical census data. A federal statistical research data center. So again, this is a way to access restricted use versions of data, and specifically IPUMS harmonized decennial census data are available in FSRDCs. The process for accessing FSRDC data is not brief, so I don't mean to advertise this as being wildly accessible to lots of folks, but depending on your research application, if you needed a restricted use version, that might be a consideration. Under documentation, I'll open the user guide in a new tab here to walk you through a few things. This has more information on things like sample designs, complex variables. Right here, we talked about those family interrelationships, geography, occupation and industry measures. So this is really helpful. Reference materials, I'll keep scrolling down for working with dollar amounts, right? So inflation, top and bottom coded values, that there are top and bottom codes for things beyond just dollar amounts. Going back on this left-hand menu, sample descriptions, questionnaires, right? So you can see the original questions that are asked. And then the last one I'll note is the revision history. If we make a change to the data, we want to be really transparent about that, right? And that gives you a chance to look and say, something in my analysis looks different. Did I change something? Did something in the data change? So this is a really nice way for you to track that. Support, these are some assorted user support resources. Under the research tab, when you register to use IPUMS, you agree to cite us in your research that uses IPUMS data. This helps us keep getting grant funding. So that's what this citation thing is. I'll pause here to note that you also agree to not redistribute the data without permission. Basically, we want everyone inspired by your research to make their own account and get their own data extracted, because this also helps us with grant funding, and that helps us keep providing these resources free of charge to the research community. And then the IPUMS bibliography, you can use that to see the research that folks are doing with IPUMS data. Now that I've walked you through that left-hand menu, thanks for bearing with me and trying to track some of the documentation. I'm going to go ahead and click on Get Data here, because this is where I think folks want to go initially. So I'm showing the IPUMS USA website today. This is a really similar layout and approach for all IPUMS microdata sites. So if you're thinking, gosh, I really am not interested in US data, I'm much more interested in the demographic and health surveys, the tutorial today and this website demonstration is still going to help you navigate that. At a high level, to create an extract from IPUMS, what you want to do is select variables and select samples. Right, you're choosing the samples of interest and the variables of interest. I like to select samples first, and I'll show you why. So I'm going to go to, you have household and person level variables. Household level variables are things that are applicable for everybody in the household. So household income measures, geography, right? Those values aren't going to change by person. Your personal income from wages, for example, might vary by person, but the total household income, that's true for everyone in the household. So I'm going to click on person demographic here. And you'll notice that I'm seeing a lot of, this is a pretty wide display. So each row is a variable name. There's the label. And then these columns correspond to samples, and an X indicates the variable is available in that sample. This is really helpful. The reason I like to select samples first, I'll click on select samples here, is that I don't need to, if I'm only interested in 2019, I don't need to see whether or not something was available in 1850. That uses up a lot of screen real estate. So let's go ahead and use 2019 and the 2015 ACS. I'll go ahead and submit sample selections there. And now you can see this view has really been cleaned up. I can see which variables are available there. I can, again, here we have the household and the person level variables. Before we dig in further to the specific variable pages, I also want to point out, today we're looking at harmonized variables. I'll let this info box pop up. Harmonized variables, right? These are consistently coded across census years. Source variables are the unrecoded versions that are unique to each sample. So if you don't like our harmonization approach, you can go ahead and grab that source variable, right? And you can say, I think I want to do this differently. So that's part of an effort at making that easier for you to dig into that. Those unharmonized or source variables are available for IPUMS CPS and IPUMS International as well. So we're here in the person demographic variable group. You can see the variables. I can add them to my cart directly from here. So I can click this plus button, and you'll notice up here in the upper right-hand corner is my data cart. So that summarizes information. So right now it says that I've got 2 variables. I'll add the variable sex, and you'll note that it increments up to 3 variables. I'll add age as well. And now I'll go ahead. So you can add things that way, but you can also click in and learn more information about a variable. I strongly recommend doing this. This is very, very helpful. So there's a brief description of the variable. Relate describes an individual's relationship to the head of household or the household reference person. That's right. There's some other details here. The codes. So what are the numeric codes associated with this? We talked about the general and the detailed before, right? Relate is a category you might imagine that has a lot of variation over time. For example, same-sex spouses or same-sex partners weren't previously in earlier years of the data. Some things happen to change the sex or change the relationship status of those persons. So that's right, a category that's now available that didn't used to be. So if I click on detailed codes, you can see there's a bit more detail here in these versions of the codes. Comparability, again, there's a lot of change over time for this variable. So this is broken down into, okay, you want to think about group quarters, you want to think about differences in the potential response options or the categories. I'll keep scrolling. The partner friend category in particular, an unmarried partner is really worth noting. And then there's the 1910 and 1920 Puerto Rican census samples have a specific note. So it's helpful to get those detailed notes on changes over time that you should be aware of. The universe, who was asked this question, right? If you're really interested in child labor, but all of the workforce questions are only asked of persons age 16 and older, that's going to be a problem, right? That it won't work that way. So the universe is really helpful information for that. Availability simply summarizes where this variable is available. The questionnaire text, here you can see what the actual questionnaire asked. I'll note here you can jump in if you click on this view entire document, so you could see how these questions occur, the order, right? And that might be important for things like, when people include questions about sexual orientation and gender identity, are they included in a demographic section? Or are they included in a section of the survey that's asking about risky health behaviors, right? That might affect how people interpret and answer the question. You might want that information or to see an immediately preceding question. So that's the questionnaire text. The flags, so there are data quality flags associated with harmonized variables. So you can get information on those here. I could follow these links to those pages and add them to my data cart. I'm not going to, I'll show you an easy way to add those at the end. For projects that include source or unharmonized variables, you can see what the source variables are associated with this. And then unique to IPUMS USA are some notes about the ACS editing procedure. So it can be a nice reference for understanding more about data quality flags in particular. that's a really quick overview of the kind of information that's available for each variable. But when I talk about documentation, you can imagine how long inferring all of that from annual survey or annual census documents would be, and how many places you would need to look. So in the interest of time and making sure we have time for questions, I'm going to now click on View Cart and show you how to actually create the data extract. So here is a quick summary. You'll notice that I only had 4 variables in my cart, and there are a bunch of other things that have been added. These are pre-selected variables, mostly technical variables that you might be a little frustrated if you forgot to include them. So we just make sure that they're included there. So I could add more variables or more samples at this point. I'm just going to keep this very simple. I'll click on Create Data Extract. And here's the extract summary request. So I'm going to walk you through a few options that are really helpful here. So I can show, again, those samples and the variables just to make sure I have the things that I would like. The first thing I'll walk you through as a nice option is this data format. We talked about this as a helpful resource. By default, the data will come as a fixed width file that you can read into a stats package using a syntax file, but you could get things pre-formatted for Stata, SPSS, SAS, or a CSV file. You also could change the data structure. We talked a bit, I mentioned briefly, right, there are those household variables and the person variables. We provide what we would refer to as a rectangularized file. So every person record will have those household variables appended to it, and they'll just be the same for all persons in the household. But if you would rather have a hierarchical file where you have a household record that includes only household variables and person records underneath that that include only person variables, you could do that. If you only wanted households, you could get household only records. So I will note that a fixed width file is the fastest for our system to process. So I recommend that if you're comfortable using a syntax file to read data in. The other thing that you can look at here are a couple other options. Selecting data quality flags. So we can add all data quality flags at once in case you forget to add them as you're going through. So this is really, really nice. So those are all the variables in my cart for which data quality flags are available. I'll include them all. The Select Cases tool is really handy. Maybe you only care about Minnesota or prime working age adults between the age of 25 and 54 or women of childbearing age, right? You can do that. So here I could go in and select sex and age. I'll submit here. Let's say I only care about women and of childbearing age. So maybe we'll pop in, this is sort of a changing band. I'll pop in 15 to 44. So I can do that. I can include only the persons meeting the selection criteria, or I could include persons in the household meeting those criteria. So maybe I want to look at number of children in those households. So I could include anybody in a household that has a woman of childbearing age in the household. This is powered. This is kind of a cool resource for that. So I've selected cases. The attached characteristics feature is powered by those family interrelationship variables I mentioned. So I can append the sex or age or relate value of a person's spouse or either of their parents, assuming that they're co-residents. So thinking about women of childbearing age, maybe I care about the age of their spouse. So I can go ahead and select that, and it will create a new variable, age_SP, that I can look at. And so instead of needing to make the connection between a person and their spouse and then figure out the age, I just have it as a variable that's on the file. There's also custom sample sizes. So if you wanted a smaller data set, you could use this to reduce the sample size if you were worried about computational power, or not computational, the power of your computer to process such a large file. The last thing you do is describe your extract. This is really, really helpful. I showed you my extract revision history earlier, this is a little bit like, this is maybe akin to flossing, right? It's recommended, it's hard to do, but you really, really want to do it because it helps you in the future. So I'm just gonna go ahead and I will call this webinar 126, 2022. I don't know that I'll really use this extract again, but it's helpful for me to know that. So I'm not resubmitting it in a month thinking it's a project that I was working on that I put down. And I'll click submit extract. I'm prompted to log in here. You'll need an account to log in. The account is free, like the data, and I'm going to click submit extract. And here we'll land on my revision history, right? And so again, that's where this is helpful. If you really hate an extract, I could also click here and hide it. So I didn't accidentally submit it in the future. Here are the command files to read it in and the code books, the revise extract option. One thing before I stop, when this data file is ready, this will take a few minutes, maybe half an hour. The data files are delivered in a compressed format, so you will need to unzip or decompress them. 7-zip is a really great free resource for Windows machines. Archive Utility or the Unarchiver is a great resource for Macs. With that, I will stop screen sharing here and I will put my camera back on. We've got about 8 minutes left for questions, if there are any. Thank you all. Ivan, you're muted.
Yes, sorry. There's a question on the Q&A that we wanted to pose to you. Could you elaborate the use of 2020 ACS, I assume in this case, 2020 ACS in comparison to previous years?
So I can provide, this is a great question. So we just released the 2020 ACS because of the COVID-19 pandemic. There are some data quality concerns that originated at the Census Bureau, and the Census Bureau released the files with experimental weights, basically trying to account for low response rates to the 2020 ACS. We've released those. The Census Bureau does not recommend making comparisons between the 2020 ACS data and other years, that there are experimental weights. The hope is that those experimental weights have accounted for the differences in response rates, but at this point, they're not advising anybody to make those comparisons. Other questions that I want to make sure that anything that came in during the presentation we're getting to. Otherwise, I've got the Q&A open and I can follow along with some of those too. All right. I'll take a look at the Q&A and sort of start to get to some of these. I briefly, while we're on the subject of the 2020 ACS, the standard weights weren't developed. Only the experimental weights are offered. They're available underneath the same variable name. So per weight or household weight are the corresponding weights. They're the same. There are no standard weights that were offered. A question about data quality flags. Why use them and why select one versus all of them every time? So it depends on your research question. Essentially, data quality flags tell you if a value, usually if a value was allocated or not. So you can think about, there's that ACS editing procedure tab, right? Things that might happen. I'm trying to think of examples. So certain occupations, sometimes when occupation values are coded, some data providers include a check for education. So if you report that you're a doctor, but you report a high school education, they may change that value. A data quality flag would let you know if that's been changed. So you might make a different choice about how to include or not include those values accordingly. I would say in terms of including them all or not, it seems to me like it's easier to just have them in there and easier to select them at the end, or to be able to look at the full list and choose the items that you would like to include. And that's where I would really look at those variable description pages to try and understand what's happening, and if that's really important. All right. If you select just a subset of a sample, are the person weights for those individuals different from the person weights if you download the entire sample? This is a great question. So in IPUMS USA, they are not, right? Essentially, your weights are designed to be representative of the population. So no, the person weights won't change when you do that. Yeah, I'll leave it there. If there's a more detailed follow-up, go ahead and post it here or email it to IPUMS. Let's see, should you also not compare the 2020, 2021 CPS data? Okay, so the question is, should you also avoid comparing the 2020 and the 2021 CPS data? There is not, to my knowledge, an explicit recommendation from the Census Bureau and the Bureau of Labor Statistics about comparisons between the 2020 and other years of the CPS. Again, I'd encourage you to read the comparability tabs. Their response rates were definitely down in the 2020 CPS. They started to tick back up in 2021. I don't know that they're up to pre-pandemic levels offhand, but that explicit guidance is not being offered. Do you include special indices based on census data like Gini and others? This is a great question that I don't know the answer to immediately. We'll try and get a more detailed response to this question in that written Q&A document. And then there's a question, I think in the ACS working paper, it mentioned that experimental weights have also been created for 2019. Will that be available? So to my knowledge, I've read that working paper, or the reference material, only briefly, but I think that the experimental weights were applied to 2019 for a comparison to the 2020 data. I am not aware that the 2019 experimental weights have been released. So again, IPUMS isn't creating these are from Census Bureau. So if Census Bureau releases them, we would certainly consider including them, but we haven't created them. And to my knowledge, they're not available. That's a guess, so please don't hold us to that. Let's see, a question, does IPUMS offer information about which city a census tract belongs to for a specific year? That is a great question. I'm thinking that would be, we wouldn't have that in IPUMS USA because tracts aren't identifiable. There would probably be a way to create some sort of a crosswalk. There are geographic resources that would help you identify that, but I'm not aware of anything that does that. And the microdata side, NHGIS may offer that. So again, an email to ipums@umn.edu or nhgis@umn.edu will be helpful for this, and we'll try and get more guidance on this posted in that written Q&A document. A question about including more international surveys. So IPUMS International is currently working on providing additional labor force surveys. So there are some available there specifically on that labor force survey question. Again, we're interested in providing additional data resources as staffing and funding allow for. And let's see, there's a question about the specific timing of more recent data. For any questions about specific data availability, I'm going to ask folks to email ipums@umn.edu. The international resource is the IPUMS International, and DHS are amazing resources. There are too many countries available there for me to have in hand all of the items that are being offered in the next section or in the next release. With that, I am going to have us wrap up right at 11. Thank you all so much for joining us today. We hope that you dig into using IPUMS data. We're really pleased to have you. And again, email ipums@umn.edu with any questions that you have. Thank you all.